Hello, everyone. Welcome to the Pioneers of Healthy Lifespan Longevity Research, webinar number 5. Our featured researcher today is a wonderful individual named Dr. Russel Reiter. He is the world's leading expert on melatonin, as I'm going to convince you. I first became aware of his work back in the mid-1990s. He published this book back in 1995 called Melatonin, sort of breakthrough discoveries about what melatonin can do. And the book has references, but I followed his research since then. He's never stopped researching this subject and publishing papers on it. He's an incredible individual, as you're going to see. So let's get down to business and learn about his career trajectory and what he has provided to the world. There's a lot to talk about. So he earned his PhD in endocrinology and radiation biology in 1964. So he got his PhD in 1964. That's the same year that the Beatles played the Ed Sullivan Show. So I will say, in my opinion, the Beatles changed the world. And Dr. Russel Reiter went on also to change the world in a big way. Bringing melatonin research to the forefront has actually been a huge discovery. He, over his lifetime, has been awarded 3 honorary Doctor of Medicine degrees and a Doctor of Science degree. He's published, 1,200 research papers as of 2012, and he's continued to publish since then. He's helped postdoctoral students receive their PhDs. He's received numerous research awards. He's the editor-in-chief of the journal Pineal Research. He's been on the editorial board of 26 other journals. My understanding is that he's still a professor of cell systems and anatomy at the University of Texas Science Center in San Antonio, Texas. A lot of his research over the years centered around the impact of melatonin in biological systems. If you want to see the research he's published in the last couple of years, just click on that link below. There's like 41 research papers he's published just, since the pandemic started. There's a great 1-hour interview with Dr. Russel Reiter that was recorded last year, like April 29th, 2022. He was 85 years old at the time. It's really worth watching this interview. He's a very engaging guy, still very enthusiastic, sharp as a tack right there. And I think the takeaway message from the interview is that he really thinks that everyone over the age of 45 should consider taking melatonin. It's not a miracle molecule, but as he calls it, it's a wholesome molecule. In other words, it pushes human physiology towards disease prevention, longevity, anti-aging, and it nudges it away from disease onset and more rapid aging, even keeping the immune system stronger, as you're going to see. So I'll touch on a lot of the research that he talks about in the interview. I've sort of covered here today, but to hear him talk about it firsthand is really a very special moment. So I suggest you watch that interview. He's a great guy. Some quick facts about melatonin. As you know, it's produced in the pineal gland, released upon darkness, helps to set the body's circadian rhythm. It's a water-soluble and fat-soluble antioxidant. That means it can work in the cell membrane area that's fatty, waxy, around the mitochondrial membrane, very important. But it also works in water-soluble areas like the cytosol and in the bloodstream and the cerebral spinal fluid. So the only other molecule we know that can do that is alpha-lipoic acid. And alpha-lipoic acid also helps to raise glutathione. I have alpha-lipoic acid in our product called Ultimate GLX, raising glutathione levels, but alpha-lipoic acid has some other unique features. But melatonin is both a water-soluble and fat-soluble antioxidant. It's very important because it's in the brain, and after glutathione, it's the most important antioxidant in the brain. The brain generates a lot of free radicals because it uses 20% of the body's oxygen at any given time. So you need to protect your brain from oxidative stress. Melatonin and glutathione do this, but as you get older, both melatonin and glutathione decline. So bringing those levels back as you get older, everyone thinks is quite important. Melatonin also helps you get into deeper levels of renewing sleep. It modulates the immune system, as we're going to talk about. There's receptors, melatonin receptors on breast and prostate cells, as well as immune cells. And stimulation of those receptors, as you'll see, plays, we think, an important role in preventing cancer to some degree in those tissues. It's also been used as an adjunctive therapy for breast and prostate cancer, as I will show you. It's a ubiquitous molecule. It's found in every plant species, every animal species. This molecule is billions of years old. There's higher melatonin levels in the cerebral spinal fluid than in the brain itself, and we think that's important. Certain tissues can make their own melatonin for their own purposes, but only the pineal gland can release it into the bloodstream so the body can get access to it. 7 clinical trials at least have shown that melatonin helps to reduce the severity of COVID-19, something that you don't see talked about too much on CNN. And sales of melatonin has steadily increased over the years. It's a $1 billion industry as of 2021. About a little over 2% of the population use melatonin on a regular basis right now. So we look at melatonin synthesis and detoxification. It's synthesized from tryptophan to 5-hydroxytryptophan to serotonin. Serotonin becomes melatonin in the pineal gland. We'll look at this, and it gets directed to released into the peripheral circulation, bound to albumin. And there's also melatonin in the cerebral spinal fluid, as I said. Half-life is only 40 minutes. And then the liver detoxifies it and converts it into 6-hydroxymelatonin. That's what you see in the urine. And that 6-hydroxymelatonin is a very good indicator of your melatonin status. So a lot of researchers use your urinary morning melatonin levels or 6-hydroxymelatonin levels as an indirect marker of your melatonin status. Evidence has shown that lower levels of that metabolite are linked to higher risks of breast and prostate cancer, as an example. Women have slightly higher levels of melatonin. That's because they're superior beings, so they deserve to have more. On average, the maximum level of plasma melatonin in adults occurs between 2 and 4 a.m. And so you're seeing about 60 to 70 picograms per milliliter. So that's not a lot. The body doesn't make a lot of melatonin. So 1 picogram is 1/1,000,000th of a microgram. Remember that 1 milligram is 1,000 micrograms. So you don't need to replace, gazillions of milligrams of melatonin. Your body doesn't require that much. Sometimes people take too much melatonin, has an adverse effect. So we'll talk about that. Concentrations in saliva are lower. So if you're doing salivary testing of melatonin, you can expect it to be 3 times lower than you would normally see in the plasma. If you want to try to, extrapolate how much you would have in your plasma. But the body synthesis of melatonin declines 10 to 15% every decade, especially after the age of 35. And by age 45, it becomes a very important consideration to put melatonin back in your body. Here's some other melatonin key functions that impact health and disease. So this is really critically important now, that melatonin helps to prevent death of the ventral horn cells. It's the death of the ventral horn cells that actually causes amyotrophic lateral sclerosis. That's what's happening. So experimental studies show that as long as if an animal is bred to be genetically prone to Lou Gehrig's disease, if you give it melatonin, it'll maintain its melatonin receptors on the ventral horn cells. And as melatonin stimulates those receptors, it prevents the programmed cell death of those cells that would otherwise occur if melatonin wasn't there. So we think that melatonin plays a role in helping to decrease the onset of both genetic and sporadic cases of ALS. 90% of ALS cases are sporadic. There's no family history or genetic markers. It just occurs. And it seems to occur when melatonin levels decline. So this, can't prove that it prevents ALS, but I think it's something you should really consider. Read those research papers, then you can decide for yourself. Also, it experimentally helps to decrease the buildup of beta amyloid plaque linked to Alzheimer's disease. It's been shown to reverse mild cognitive impairment, which is the prelude into Alzheimer's disease, reversing it. Usually a dose of 3 to 24 milligrams. I'll show you that. It also activates the sirtuin longevity genes, right? What do those genes do? They help to keep the cell highly viable and functioning. It protects against neurodegenerative changes. It improves cardiometabolic health so you don't get diabetes. It improves the synthesis of antioxidants. So these genes are critically important for longevity and healthy lifespan. And melatonin is a stack. It's a sirtuin activating compound that helps to make those longevity genes work more efficiently. as he says as an interview, Russell Reiter says during the interview, melatonin decreases DNA damage. It's linked to cancer. It's also been shown to slow cancer progression. In terms of neuroprotective properties, one of the main ones is that melatonin and its metabolites help to maintain the flow of electrons down the mitochondrial chain and to prevent leakage, so you get optimal ATP production and you decrease the likelihood of damage to the mitochondria itself, decreasing oxidative stress so the neurons don't die. You want to keep your brain cells, prevent them from dying. You don't get new ones. And melatonin has very important neuroprotective effects from this standpoint. Experimentally, it's been shown to block key steps in the development of Parkinson's disease, which is the second most important neurodegenerative condition after Alzheimer's disease, largely by preventing mitochondrial dysfunction. It protects the mitochondria from free radical damage and improves the flow of electrons down the electron chain. Sort of works with CoQ10 hand in hand. When you activate the sirtuin longevity genes, a lot of great things happen. It helps to regulate appetite, brings lipid levels down, helps to improve glucose function, reduces inflammation. It increases the synthesis of antioxidants, and it also helps to improve the function of breast and prostate cells, activate immune cells because they're all impacted by melatonin, block steps in cancer development, as I said. So those sirtuin longevity genes, they act as epigenetic switches on many other genes. I mean, this is a whole discussion that's separate from melatonin. Maybe we'll do a whole webinar just on this, but these sirtuin genes are important, and melatonin helps to activate sirtuin genes, so it indirectly has all these incredible effects. Once turned on by melatonin, the sirtuin-1 enzymes act as epigenetic switches that help you burn fat, keep your blood sugar down, regulate your blood pressure, increase synthesis of important antioxidants that the body makes, maintain mitochondrial biogenesis, so your mitochondria are functioning optimally, and it turns off inflammation-promoting genes. So it's even linked to decreased severity of osteoarthritis or rheumatoid arthritis, as you'll see. It also upregulates brown fat, so you start to burn more calories at rest, give those calories off through thermogenesis to the environment, helping to reduce the likelihood of weight gain. It's been used in weight loss studies to improve weight loss, as I will show you. In fact, here's a study right here, 2014, 56 overweight postmenopausal women, all given the same diet. The ones given the 5 milligrams of melatonin showed superior weight loss because it's upregulating brown fat and thermogenesis without being a stimulant to the heart or to the brain, right? So it's great. It sort of works like the green tea epigallocatech and gallate does the same thing. The green tea polyphenols do a lot of this as well. And animal studies show that it helps to protect the heart in obese species. Very often people overweight, they end up with heart damage and heart failure. Saying melatonin in obese animals helps to protect the heart against enlargement and mitochondrial dysfunction and muscle inflammation. This may also be true in human subjects. So here's a synthesis of melatonin, as I talked about briefly. L-tryptophan found in food, and then 5-hydroxytryptophan, which you can get as a supplement, then to serotonin. Then the pineal gland converts some serotonin into melatonin, but as you get older, these enzymes become much less active, so your melatonin levels start to decline significantly as you age, 10 to 15% per decade. So you can see the decline in melatonin after puberty. It starts to decline quite significantly. So by the time you're 40 or 45, you're not making a lot of melatonin, and it disrupts your sleep. Your immune system's not as strong. Breast and prostate cells are more prone to cancerous changes. Appetite's not regulated as well. Your sirtuin genes are not activated the way they should be. It has far-reaching consequences. It's a multimodal molecule. You have less antioxidant defense in your brain and elsewhere. You see the nighttime secretions of melatonin higher between 2 and 4 a.m. And as you get older, melatonin levels decline, as I was saying. One of the main immune cells, the T helper cell, the CD4 cell, has a melatonin receptor. That's the quarterback of the whole immune system, remember. It's going to instruct all the other immune cells how to fight viruses, bacteria, fungal infection, emerging cancer cells. get them out of there before they can get any traction. Melatonin is a modulator of the immune system in a significant way, largely by coordinating function of the CD4 cell, the T helper cell. There's some human clinical study applications. So I'm saying, yeah, it's a lot of interesting theory. Are there any clinical studies that have been done with melatonin to show what it can do? Yes. These are the studies of most importance. The Sleep Foundation says that it helps to reset the delayed sleep-wake phase disorder cycle. So in other words, some people just naturally are night owls where they stay up to 3, 4 in the morning. That's just their circadian rhythm, and then they sleep in. And they're not really able to cope with societal pressures as well, because society says you work between these hours and you sleep between these hours. And if you don't conform, then often it's hard to be productive at work or to hold a job or to meet your school demands. You're saying if you take melatonin, it can help to reset that circadian rhythm and get people into the regular cycles that are considered to be the societal norms. Some studies show it helps with jet lag. So you arrive at a destination in a different time zone, you wait until that night, and then just before you go to sleep that night, you take melatonin, go to sleep, you wake up in the morning, and your circadian rhythm is reset. Shift workers have shown, some studies show it benefits shift workers to use melatonin to reset their circadian rhythm. And in terms of insomnia, with insomnia, the British Association of Psychopharmacology state that melatonin should be the first choice treatment in patients with insomnia who are over the age of 55. Not all these drugs that are prescribed. This should be the first thing that the person does. There's one study showing it may slow down macular degeneration, another study that shows it may help with tinnitus or tinnitus. As you can see here, 3 milligrams. Can't guarantee it's going to help, but I think this is interesting. Melatonin also helps to increase the release of growth hormone. This becomes important because as you get older, your growth hormone levels really decline. And as a result, you get catabolism of your lean mass and you end up with sarcopenia. People become very frail and fragile as they get older. Melatonin can help to get a little more growth hormone release through the night to help give that anabolic effect to maintain your lean mass so you don't lose so much muscle mass as you age. That's another great effect of melatonin overnight. There's at least 8 clinical trials now showing that 3 to 10 milligrams of melatonin given to patients with COVID-19 improves their clinical outcomes. Shorter hospital stays, less delirium, improved sleep quality, and decrease morbidity and mortality in some studies. In fact, the National Institutes of Health in 2021, talking about melatonin and COVID-19, they said, listen, melatonin is another supplement that's been identified that has potential antiviral aspects. Could be used as a therapeutic agent in COVID-19 due to its documented antioxidant, anti-apoptotic, meaning preventing the immune system from malfunctioning, has immune modulatory effects, has anti-inflammatory effects, so you don't get a cytokine storm. When Donald Trump was hospitalized with COVID-19, one of the things they gave him was melatonin in a cocktail with vitamin D and zinc. Melatonin has been shown to reverse mild cognitive impairment. Here's some of the research on that. 3 to 9 milligrams of melatonin given at bedtime for 3 years significantly improved cognitive and emotional performance in people that already had mild cognitive impairment. In a follow-up study, another series of 96 people with mild cognitive impairment, that's sort of the prelude into Alzheimer's for a lot of people. They gave them 3 to 24 milligrams of a fast-release melatonin at bedtime for 15 to 60 months. The patients treated with melatonin exhibited significantly better performance in the mini mental state examination scale, and the cognitive subscale of Alzheimer's disease assessment scale. So their mental performance was better. Their verbal abilities were better. Better performance was found in the melatonin-treated patients for every parameter tested compared to the ones that got only other drugs to manage their condition. Also, less depression in the patients that got melatonin and improved their sleep quality. They say the results further support that melatonin can be a useful add-on drug for treating mild cognitive impairment in a clinical setting. The problem is that doctors don't actually prescribe it because it's not a drug. So this is where you need to step up and be a little bit more assertive and help your patients find other things that can improve outcomes, because a decline in cognitive performance is not fun for anybody. It's also been shown to improve sundowning symptoms in Alzheimer's patients. About 45% of patients late in the afternoon, they get agitated or they wander off, they have more disorganized thinking, they have more emotional disturbances, their attention is even worse. Giving them 3 to 9 milligrams at bedtime has been shown to improve sleep quality and suppress those sundowning symptoms the next day, and also slow cognitive impairment. That's incredible. Except that Alzheimer's patients are not given melatonin as a standard therapy. Also, it improves sleep quality in Parkinson patients. So you see the studies there. It's not going to reverse the tremor in Parkinson's disease, but it might give them better sleep quality and better overall quality of life. Sexual function in postmenopausal women. Let's stop there. This sounds very important to me. So postmenopausal women, often their sex drive, arousal, their climax ability starts to become diminished as they get into the menopausal years and postmenopausal years. There was a study of 240 women with, they looked at their female sexual function index, and it was low for these individuals. They gave them melatonin versus placebo. And it showed that over 3 consecutive months, 3 months later, the ones given the melatonin, just 3 milligrams a night, they seem to have better response on the female sexual function index. And you can read about it in that paragraph below. For male sexual function, there's some evidence that melatonin may also help to improve male sexual performance. We certainly know that males that have erectile dysfunction tend to have lower melatonin levels as part of the constellation of parameters. So melatonin is not the miracle molecule for this, but I think it can be a helpful molecule to help restore more male sexual function, along with other practices. Animal studies show that melatonin supplementation enhances or helps restore male sexual function. So animal studies also support this. What about melatonin and immunity in cancer? A lot of great studies here. Melatonin decreases the number of immune cells that are senescent. In other words, as you get older, there's still immune cells floating around, but a lot of them are senescent. They're just sitting there doing nothing. When you give people melatonin, they have more viable immune cells that can actually hunt down viruses, bacteria, and cancer cells. And particularly enhances T lymphocyte function like the CD4 cell, but other T lymphocytes as well, and helps to preserve more memory cell viability. So if you get an infection again, the memory cells can produce antibodies because they recognize the antigen from before, and that they make the immune system just that much more intelligent. So that comes from this research paper, if you want to read the details there. Other studies show that melatonin also improves the function of what are known as antigen presenting cells over here, APCs, like macrophages, dendritic cells, B lymphocytes that can actually swallow the virus and kill it on contact, and or present the antigens to the CD4 cell and get the rest of the immune cell into the function, into the fight. As I said, it upregulates CD4 cells, and therefore it helps to improve all other lymphocyte function. And natural killer cells also rely on melatonin for modulation. They're part of the immune system that can just instantly identify an emerging cancer cell and kill it right away. So this is critically important stuff if you want to, have a long, healthy life and minimize risk of disease. That comes from this research paper here in the International Journal of Cancer Research in 2015. And there are some highlights from that article that I thought I would tell you about. So I'm going to send you these slides so you can review these on your own, but this is some of the highlights from that study that I thought would be important. With respect to breast cancer, there's good evidence that higher melatonin levels are related to less breast cancer incidence. Dr. Lassoni in Italy was the first one to use melatonin as an adjunct in breast cancer treatment. There's a fantastic review article in 2010 that is by this Dr. Kazar, who outlines the 10 different ways that melatonin actually helps to protect against breast cancer. So this is one of the charts from the article showing how melatonin enters the cell, attaches to melatonin receptors. It upregulates a transcription factor called calmodulin, which then goes to the nucleus, and it basically It helps to decrease inflammation. It induces programmed cell death of emerging cancer cells. It upregulates immune system function. The retinoid receptors help to slow down the rate of cell division and make the cells more mature. It's acting as a water and fat soluble antioxidant. But she then outlines these 10 specific ways that melatonin prevents breast cancer. So I've laid it all out for you here: reducing estrogen and progesterone, acting as a selective estrogen receptor modulator like tamoxifen or raloxifene, these drugs that they give cancer patients. It's an aromatase inhibitor, so you block the oversynthesis of the dangerous estrone hormone, slows down the rate of cell division. It preserves adhesion molecules, so breast cells are talking to each other. As soon as they lose that communication because they don't have these adhesion molecules, then cancer cells can start proliferating. It helps to prevent cancer cells from re-lengthening their telomeres. That decreases their likelihood of having immortality. It also blocks the 15-lipoxygenase enzyme, so you can't make this dangerous fatty acid. This is the 13-HODE. What cancer cells like to make this prostaglandin or icosanoid to help them proliferate. By blocking the 15-lipoxygenase enzyme, it takes away that advantage. Binds to retinoid receptors, which then slow down the rate of inflammation and decrease the inflammatory response, modulates immune system function, suppresses the release of cytokines that drive the cancerous process. So melatonin, it's multimodal in its effects on cancer. This is a great example. Women that have had breast cancer that are post-operative after their breast surgery, one study showing 6 milligrams of melatonin lowered symptoms of depression, helped them get a better night's sleep, and their quality of life was better in the ones that got the melatonin. Melatonin and prostate cancer, a lot of studies show that melatonin reduces the risk of prostate cancer. So here's the research, 2017, some human volunteer studies showing different aspects of how melatonin is toning down prostate cancer, but really it's slowing down the rate at which cells divide, it's increasing division, and it's encouraging any emerging cancer cells to commit suicide. So they collectively, the scientific literature supports the potential application of melatonin in the prevention and treatment of prostate cancer, especially androgen-independent prostate cancer, which is the hardest cancer to treat. This is a fabulous little review article on this, showing the multiple ways that melatonin helps to inhibit prostate cancer. So you see melatonin blocking certain receptors here and here, so that ultimately you have less stimulation of the androgens affecting the receptor. You slow down the rate of cell division, and you also induce programmed cell death. So in that same article, their concluding remarks here in 2021 is that the underlying mechanism of how melatonin inhibits the growth and progression of prostate cancer were related to the promotion of the androgen receptor exclusion. So it's helping to tone down the androgen receptor cascade. It activates the melatonin receptor signaling, and it modulates the metabolism of prostate cancer. It inhibits angiogenesis, so they can't get new blood supply. It changes the neuroendocrine features, and it induces apoptosis. It encourages existing prostate cancer cells to commit suicide. So they're saying that we've seen it work and enhance the efficacy of chemotherapeutic drugs for prostate cancer. It makes them work, makes the drugs work better. And they're saying, in fact, as I said to you earlier, your morning urinary levels of 6-hydroxymelatonin, which is the metabolite of melatonin after it's been detoxified by the liver, is a very good indicator of what your risk of developing of prostate cancer might be. So if you have very low levels of that metabolite, risk of prostate cancer seems to be higher because your melatonin status is lower. What I'm saying is after age 45, consider taking some melatonin so you don't end up with these low levels. Some other studies experimentally show it may help to interfere with ovarian cancer, oral cavity cancer, and some other cancers that you see there. Even affecting, enhancing radiotherapy and some anti-cancer drugs used for lung cancer patients. So that's a fantastic review article in 2017 by Lee and fellow researchers, worth reading. The Journal of Pineal Research in 2017 says, melatonin, here's how it affects the sirtuin longevity genes. In healthy cells, it turns on the sirtuin longevity genes, which helps to reduce risk of cancer and enhance survival. Whereas in cancer cells, it actually turns the sirtuin gene off. So it has this pleomorphic effect, where in healthy cells, so here you see normal cells, melatonin is stimulating the sirtuin genes. So it's preventing the cells from dying. It decreases endoplasmic reticulum stress, which helps with survival. It has anti-aging effects. It reduces inflammation. It upregulates antioxidant synthesis and increasing the synthesis of glutathione and hemoxygenase enzymes and catalase. Whereas in cancer cells, the melatonin is turning off the sirtuin gene so that the cells can't divide and proliferate as easily, so they become better targets for cancer drugs. You can't make drugs that can have this sort of biphasic effect, if you will. So the explanation of how that works, I put onto these slides if you want to read more of the details, including what all the abbreviations mean. In terms of safety of melatonin, the National Institutes of Health say these are the adverse effects of melatonin. It's very non-toxic. It has some mild side effects: drowsiness, daytime sleepiness if you take too much, headache if you take too much, nausea for some people if you take too much. There's no evidence that people develop a tolerance. People are like, well, if I take melatonin, am I going to become addicted? No, you're not going to become addicted to melatonin. It's not going to suppress your body's normal melatonin secretions either. But you would avoid, you're taking a pretty heavy sedative drug like benzodiazepines or something. You can't add melatonin to that. Contraindications, because you don't really know the effects on pregnancy and breastfeeding, you wouldn't take it then. Because it stimulates immune function, it might actually flare up autoimmune diseases, which it can do if you take too high a dose. Now, I know people that have autoimmune disease that take low doses of melatonin. It helps them a lot. It's when you start taking 3, 5, 10 milligrams of melatonin, you can flare up an autoimmune disease. Same with people with post-organ transplants who are on immunosuppressant drugs. You can't go trying to stimulate the immune system when you're given drugs trying to suppress the immune system. In dialysis patients, you have to exercise caution. You need physician consent. People with liver disease, you need physician consent. In terms of toxicity, they try to see how high a dose, what dose it would take to kill an animal just using melatonin. They're saying, we can't find the dose. We can't find a dose that actually kills them. Higher and higher, we can't kill animals. There's nothing fatal, even if we give them 100 milligrams per kilogram of body weight. As Dr. Reiter says in the interview, he says, an animal, you give super high doses to an animal to try to kill it, looks at you, goes, is this the best you got? Do you have anything stronger? So it's pretty safe. Here's my recommendation is how to use melatonin. For general prevention, anti-aging, longevity, and for healthy lifespan, you don't need high doses of melatonin. 15% of an oral dose gets absorbed and reaches the bloodstream. It readily crosses the blood-brain barrier. I would suggest begin taking melatonin at a low dose at age 45, only 500 micrograms. That's 0.5 milligrams, because your body only makes picograms of melatonin. You don't need massive doses. People start taking these high doses right away. They get a headache. They start dreaming in technicolor. They don't feel well. They get nauseous. They go, I tried melatonin. It doesn't work for me. I'm like, that's because you took a dose that's too high. You start low and then you titrate up, right? You titrate up to the dose that gives you a good night's sleep without the morning hangover. We make this product, Adeeva Sleeping Naturals. I think it's the best in the marketplace because it combines low-dose melatonin with 5-HTP, which will help you make serotonin, which also induces sedation, turns off appetite, gives you a feeling of well-being, and GABA, which helps get you to sleep. Stimulating the GABA receptors is how you actually get to sleep. Melatonin puts you into a deep sleep. And Bacopa-Moneri, which helps the brain improve memory consolidation. It's when you're sleeping that you convert short-term memory into long-term memory. You want all these things happening congruently while you're sleeping. So melatonin with these 3 other agents is really the right approach in my view. It's a very gentle, non-toxic sleep aid. These are dosage considerations. At age 40 to 50, you just need 1 capsule. 50 to 60, I would take 2 because your melatonin's dropped further. From age 60 to 70, consider taking 3, as I do now. At age 70, you might want to go even higher than that. But unlike Valium and other benzodiazepines, there are many advantages to using this product over those drugs, and I've laid it out here with all the references. We'll come back to it. Now, for patients with other clinical needs, I would begin with Adeeva Sleepy Naturals, and then I would add additional melatonin if they have Parkinson's disease or mild cognitive impairment, they're breast or prostate cancer survivors, they're weight loss patients, they have macular degeneration or tinnitus, they have an infection, COVID-19 or another infection, they're an Alzheimer's patient with sundowning, you want to enhance female sexual function or male sexual function, you might want to add a little bit more. You may not need to in cases of male sexual function. But for all the other ones, you would start with Adeeva Sleepy Naturals and add some additional melatonin based on the clinical studies that I showed you. I tried to outline you the dosage considerations there. But for Adeeva Sleepy Naturals, that's sort of how you approach it. I would recommend strongly that you see the webinar that I taught on this subject of natural sleep aids versus prescription sleeping pills. What's in your patient's best interest in terms of health and sleep quality. I review all the research so you can see how all those 4 synergistic nutrients in Sleepy Naturals work together, outperforming and much safer than typical sleep aid drugs that doctors are recommending these days. So I want to thank you for sitting, and I hope you enjoyed this. We had a lot of people registered for this webinar. The ones who are not here live, of course, will get this sent to them. If you want to contact us, Dr. Russel Reiter yourself, here's how you can do it. He seems like a very genuine, decent human being. He's 86 years old now, I'm assuming. I don't want all the research in his life work just to be forgotten about because, in the medical circles, this guy's not talked about at all. But in the real world of health and longevity, he's an absolute superstar. Very grateful to have seen the research he's published over the years. I think we owe him a great debt of thanks and gratitude. So on that note, I will say thank you very much for attending.